to bring you some information about how to do just that. Right, Diane?
That's right, Nick. Thank you. Stephanie Turkel is a registered dietitian, and she joins us this morning. We're talking about gastroesophageal disease, or known as acid reflux disease. And that's when a lot of people have problems with the contents after their stomach coming up in their esophagus, with the sphincter that opens up and lets some of the stomach acids come up. And what are the things that that cause that?
Well, there are a lot of different reasons that can cause gastroesophageal reflux disease. If a person is overweight or obese, that could be a risk factor. It could also have to do with the types of foods they eat. Some people are more sensitive to some spicy foods and citrus foods.
No, it's very, very painful for a lot of people.
Yes,
and some of our viewers have called in about this, and that's why we're talking about it. And a couple people here at work actually suffer from this as well. And some of the foods to avoid are, of course, tomato sauces, anything that's really spicy, which is unfortunate because spicy food is very popular here in Southeast Texas.
Yeah.
And what are some of the other foods? I mean, there's alcohol, there's Mike's soda here.
Tobacco, obviously not a food, but can also influence the severity aggravate it. And also caffeine, carbonated beverages, coffee, even decaf coffee can aggravate acid reflux, along with chocolate, some of your citrus foods, onion and garlic.
And we've got some of those examples here on that. Okay, and we've got a picture up too of the digestive system, if we could kind of throw that up to sort of illustrate what the issue is, as far as seeing where the stomach is and how it comes up into the esophagus. And then we've got a second picture up too, and this is the upper gastrointestinal. And to kind of talk a little bit about this picture.
Okay, well, when food is consumed or beverages, it enters the mouth and it travels down the esophagus into the stomach. And normally, of course, the lower esophageal sphincter or valve that leads from the esophagus into the stomach is to remain closed. But whenever the pressure inside the stomach kind of pushes on that valve, it'll go back, the contents of the stomach can kind of go backwards into the esophagus, and it's very acidic, and it can cause irritation of the esophagus.
If we could throw that third picture up too real quick and explain this as well, what you were talking about.
Right, the top picture shows what a normal valve, lower esophageal sphincter, remains closed, and the bottom picture shows where it's opened. It could be due to a faulty valve, or again, the increased pressure in the stomach causing it to open and causing the contents to go backwards into the esophagus.
Now, we've talked about some of the foods that people should avoid. Now, also wearing tight garments around the waist can affect this, and some of the reading that I did, and don't lie down after eating.
That's right.
Eat smaller meals, as you had mentioned, overweight, and then sleeping with your head raised about 6 inches and using a wedge, but not pillows.
Right, right. The wedge really helps increase the head of the bed about 6 to 7%. Really helps.
Now, what are some of the things that people can do? I mean, we've got some antacids here.
Right.
And is that going to, I mean, that helps for a while, but...
Right. Well, if your diet and your behavior modifications don't help, you can go to medications under the advice of your physician, obviously. To start, you may want to try an antacid. Antacids are great because when you're feeling the symptoms of reflux, you can take an antacid and it stops it almost immediately. But they are short-acting, and if you have more of a severe problem, you may want to try something like Pepcid, which can be taken before meals, or even a daily regimen like Prilosec or Prevacid.
And some of those are, you have to get a prescription for.
That's
correct?
Right. Some are over the counter.
And what are really some symptoms of that? Because they can be confusing for other ones. When I understand it's very painful, the breast, right at the breastbone.
Heartburn can feel like chest pain, and causes some people to go to the emergency room because it can be that painful. And it's hard to tell whether it's heartburn or really, symptoms of like a heart attack or something.
So what are some of the foods that people should eat, or that would be good for it, or does it really matter as far as we know what to avoid?
Right. Okay. Well, obviously knowing what to avoid helps. There may be some trigger foods that cause reflux for some people and not for others. It helps to eat a low-fat diet, or maybe, like you said, eating smaller, more frequent meals. It's really the volume of the food in the stomach that can cause that increased pressure for the reflux.
And really not being inactive or lying down right after you eat.
Yes, it helps. Yeah, it helps to, after you eat, it helps to have about 2 to 3 hours where you're not physically active or you don't lie down, to kind of help your body digest the food.
And then if it's severe, just see your physician.
Absolutely. In severe cases, some operations can help with, you know, with reflux.
Okay, thank you very much, and we'll be talking to you again next week. We appreciate your time, Stephanie. We'll be back with more news and weather in just 2 minutes.
Cardinal Glass, your